Good morning everyone, and welcome to the live Endolift demonstration. My name is Dr. Priya Verma. I'm a GP Research Fellow, Aesthetics Doctor and Key Opinion Leader for Endolift in the UK. I'm joined today by Professor Ghanem, who's a plastic surgeon, aesthetics doctor and also Fellow Key Opinion Leader for Endolift in the UK. We are really excited to be sharing with you this brand new revolutionary technology called Endolift. Now, I'm just going to start, for those of you who don't know, with a brief background into the company Euphoton. So Euphoton is a medical devices company, very well established in Italy, with over 40 years of experience in medical lasers. It was initially pioneered by Professor Marangoni, who was a specialist scientist in the development of vascular surgery lasers. Now, today we're going to be focusing on the device which I have here next to me, the LaserMar 1500 device. This is a multifunctional device with numerous applications, but we will be focusing on the Endolift procedure. Now, Endolift is now distributed in over 50 countries worldwide, and we've seen over 10,000 procedures being done year on year. Today we are lucky enough to have Professor Ghanem, who will be doing a live demonstration for us on a patient model that we've got, doing a full facial Endolift procedure. I'm going to also just give you a brief background into Endolift. So what is Endolift? Endolift is essentially it's a laser procedure, and I have the fibre here, the actual device here. Now, this is a very, very small microfibre, which is almost as thin as 2 human hairs. So much, much thinner than any cannulas or needles that we use in our injectable aesthetic practice today. And what we do is we insert this just under the skin, into the hypodermis, and it shoots, as you can see, a laser beam. So if you can see that there, so we've got a nice laser beam coming out. That is inserted into the skin. We use a sort of tunneled fan approach to create microchannels of laser energy. This heats the tissue and effectively improves the remodeling of the skin at the dermal layer. What we're trying to do is, from a clinical point of view, is enhance sort of the laxity that the patients might present with by improving skin tightening, but also what we can do is lipolysis with this procedure. Now, if you have a patient who has got excessive fat, for example, either in the face, so areas under the chin are quite commonly affected, or in the body, we can treat the abdomen, for example. With the correct settings and the correct parameters on the device, we can actually achieve a very non-invasive lipolysis, which is permanent fat loss. So it's a remarkable machine, which you'll see today. When we assess our patients, you'll be able to see what sort of assessment we do, how we set the device up, and also, what sort of results we're getting. Now, what's really exciting is that, unlike many other procedures, with the Endolift, you can actually see immediate, instant results. And those results continue to improve month after month until you can see a final improvement and a final result at around 6 to 8 months. So, from a practical point of view, in terms of the advantages of the Endolift in comparison with many of the other commercial treatments available on the market, the main things are that this is minimally invasive, and the results we're achieving are akin to a surgical facelift. So it's a real game changer in the industry. And in terms of the patient's perspective, with just a very small amount of percutaneous local anaesthetic, the patient is very comfortable, as you'll see today, and we'll ask the patient at the end of the procedure how she found the procedure. But you'll see that it's a very comfortable procedure, very quick, very, in terms of results, very fast results. But also, there are no incisions involved, there are no complications of surgery, and it can be done in an office environment. So here we are in a clinic. There's no need for an operating theatre or surgical environment. So the results, the advantages really are really quite astounding. And the other thing I would say is that from a practical perspective, if you are a clinic owner, this procedure does not require CQC registration, so it can be done in a whole breadth of clinics. And also, in terms of the establishment of the device, it is approved and certified by the FDA for a laser-assisted lipolysis. So an absolutely fantastic machine, and we're so excited to be presenting it to you today. I'm going to hand over to Professor Ghanem, who's going to talk to you a little bit more about patient assessment and skin aging.
Hi everybody, thank you very much, Priya. That was a comprehensive introduction. So for those who don't know me, I am a plastic surgeon and I work in central London, and I also teach at Ulster University College of Medicine and Dentistry, where I direct the program of facial aesthetics. So when I was introduced to the Endolift procedure, I was quite excited about the potentials this procedure offered. If you, some of you might be colleague plastic surgeons, some of you might be aesthetic practitioners, and you all can imagine that when patients come to us with facial or body appearance issues, they usually hover around three domains. They are the main domain, the main manifestation of aging. The first one is surface damage, the second one is volume loss, and the third one is the laxity issue. And in relation of how we can offer patients these treatment, we need to tailor it to each individual patient. I usually try to explain to my patients that the options available are like traffic light system, where the green is very minimum interventions that have very little downtime, that they are cheap, but the results are also humble. And some patients go for the green. I tell them that there is the red, which is plastic surgery. It's extremely effective, however, it is also a very serious procedure that requires sometimes general anesthesia and prolonged downtime and careful post-operative care. It's usually costly and requires certain facilities and a lot of preparation. So in the middle, we have the amber procedures. These tend to be technology-assisted interventions, such as laser-assisted lipolysis or laser resurfacing, sometimes radiofrequency, all the technology that has come over the last few decades to overlap these minimum interventions with the surgical interventions. As you are aware, most of our patients now in a hectic lifestyle, before the COVID time, I think COVID has changed things for all of us, they often come to me and say, Ali, we know you're a plastic surgeon, but we are very sorry, we don't want surgery. Either they cannot afford surgery or they don't want the risk associated with it. And then you have to think of the amber domain. So in relation to the amber domain, it doesn't come without caveats, because most of the energy-based devices also come with a lot of pain. It requires preparation. There is a significant downtime, sometimes with swelling, with open wounds, etc. So we have not yet reached the ideal intervention that can be applied across all ages, from the young patients who have a little bit of laxity maybe under the skin that they would like a more defined and sculpt face. Okay, we can transform them with maybe few mils of hyaluronic acid, but that is not going to last long. So also, it is going to be very challenging to offer them a facelift. So for that, early patients, also we have the older patients who just need a little bit of improvement, or like moderate improvement. They say, I don't want to look out of my age, I want to look my age, but a little bit tidier. So for those people, again, they kind of like will not benefit from simple interventions like toxins and fillers, but also you will have a challenge kind of taking them with some commodities to the operating room. So from here, Endolift appeared to me as an important intervention that can bridge this gap. And having done my first cases in the learning curve, I was really impressed. I kind of had the pleasure of observing very closely a family member who underwent the procedure. And I saw them from the 1 minute after the procedure until 2 weeks after the procedure, and I was amazed. Like, there is no swelling. Little entry point that's capped off within like 2 to 3 days without leaving any post-inflammatory hyperpigmentation or kind of hypertrophic scarring or the problems that we see usually with energy-based devices. So I was really excited about this procedure, and I'm starting to offer it to my patients here at the Cranny Clinic and at the Aesthetic Regenerative Clinic and at Nova in Greenwich. So in a way, I'm really excited to introduce this to you. I have to warn you that this is a very new technology. And as a new technology, the whole community has to be very careful in adapting it. So engagement with this technology should come with a lot of preparation from the scientific background, understanding laser, doing your safety checks, making sure that you understand the physics of laser, being certified, getting the CPDs required for that, and also understand the anatomy very well. Like any area in the lower face, we sometimes face with the challenge of the marginal mandibular nerve palsy. And with this procedure, the only significant side effect that has been reported in over 10,000 procedures worldwide was less than 1 in 1,000, but it happened in 2 documented cases of a transient neuropraxia of the marginal mandibular nerve. So this is something that you need to warn the patient of, and also observe the danger zone and operate in anatomically safe areas. However, even if this thing happened, like it happened with facelift, like it happened with other energy-based devices, the treatment and the management is easy. The patient will recover between 4 to 10 weeks, and then usually we deliver botulinum toxin on the contralateral side, and by the time the botulinum toxin wears off, the nerve on the damaged side will have recovered. So without further ado, I would like to transfer to you my personal excitement, and I hope that many of you will become fellow practitioners, and we look forward to having a UK special study group and a governance group to move forward with our cases and discuss further. And now the following part of the webinar will be for me to introduce the model and then mark it through with you, discuss the potential in this particular case, and then demonstrate that procedure for you. I'm going to go and check about the model.
Brilliant. So what you'll find is that when we have our patient here, we will assess the patient. The main things when we're assessing the patient clinically is we want to think about 2 main things. We want to think about whether or not they've got thick skin, whether they've got thin skin, because this makes a difference to the device settings. But also, how much adiposity do they have? So are there pockets of fat that the patient is concerned about? Is there a lot of jowling? Is there a lot of, is there a lot of laxity that needs addressing? All of these things make a real difference to the approach to the device. Now, on one of our training courses, you'll hear in a lot more detail how we select the appropriate device settings and how you tailor that and make it more bespoke to each patient in front of you. Now, just to give you a very brief sort of overview of the device and its settings, the main things you're going to be looking at are the amount of energy that you're delivering. So we measure that in, so the power that we're delivering is measured in watts. So this can be tweaked depending on the patient in front of you. How much work do they need? How much tissue there is that needs tightening. But then also you want to look at the amount of fat. And so the very important thing here is this is not a continuous laser beam. This is a pulsed laser beam. And the way we differentiate is by setting the T on and T off. So T on is essentially how long the laser beam is actually on for. So upon pressing the pedal, for what length of time am I actually delivering laser into the tissue? The T off is how long am I allowing the tissue to rest for. These are really important settings, and like I've said, I won't go into too much detail, but these are important because the setting really determines how much fat loss you get for how long the T-on is on for. So, and also in terms of how much work you need to do, how much skin tightening needs to be done, we can tweak those settings. And the beauty of the procedure is that once the settings are on, throughout the procedure, we are able to assess halfway through. So we can bring our patient up, re-examine them, see how much skin tightening we've already achieved. If we feel that, okay, we're halfway through, our recommended parameters for the amount of joules of energy we're going to deliver, the we're not seeing an enormous clinical benefit here. We're not seeing, quite the clinical benefit that we were hoping to. We can tweak the settings, and it's as simple as that. So, but this obviously will come with experience and with having not only observed but also conducted many treatments myself. Now you can start to appreciate, just how those settings can change the clinical outcome, and you'll see that today. So our patient has arrived. We're just prepping her, and we are going to start with numbing the patient. So I'll talk a little bit about pain relief in this procedure. Now, it is possible to do the procedure without any local anaesthetic. We found that actually, with just a little bit of percutaneous local anaesthetic, the patient's more comfortable. And so, in effect, just a very small amount of, we're using lidocaine here today, reconstituted with normal saline. We're finding that actually the patient's a lot more comfortable. You're able to, even go up in the settings, which can sometimes mean a little bit more heat, a little bit more pain. So we're still finding that they're very comfortable despite changing settings on the machine. So we will be doing just some percutaneous anaesthesia for the patient who's having her jawline, jowls and under chin area treated today. And we usually say just allow for sort of 10 minutes or so, allow you to prep the machine, get sterile, things like that, for it to work. But we will ask the patient today, later, after the procedure, how she finds it. But usually it's been tolerated very, very well.
So we have the patient here. I just asked her to remove her jewelry from around the neck. It would be nice to have all the area of the face and neck and the upper décolletage open so that you can recognize the anatomical landmarks. And I'm going to present the patient to you in a couple of seconds. So maybe the camera can come here, and you could see that all what we need for this procedure is the fiber. We have a cleaning solution. We have a non-adrenaline lidocaine 2%. We have some sodium chloride, some just simple filler cannula, withdrawal needle, and 20 ml syringe with some gauze. And that's all what is needed.
Just a bit more comfortable, maybe sitting upright.
Yes. Welcome. So I have met my patient almost a couple of weeks ago, and we discussed her concern of facial aging, and for the purpose of time we will go quickly to the laxity aspect. And as you could see, she is a very beautiful lady who has a very nice and balanced face, very beautiful eyes, some simple aspect of surface damage. You could see some dynamic and static line, a little bit of dyschromia, and then kind of a little bit of a solar spot here on the right zygoma. As far as volume, you can see that a little bit of volume loss in the paranasal area, in the soothe, medial and lateral malar area, just a touch in the temple, and then we can see maybe on more lateral profile the marionette area with the pre and post-jowl sulcus. The most remarkable aesthetic sign in relation to aging in hair is the laxity. So because of the volume loss in the middle face, you could see that deepening of the nasolabial fold and the marionette line, and some degree of adiposity and blunting of the cervical-mental angle in the upper neck. So mostly the lower face that is the most area of her concern. And when I asked her to point at the areas that she doesn't like, she actually pointed to this, and that's the most common aspect of most of our patients, the jowls and the submental laxity or adiposity. So if we are to think about the danger zone, the fourth branch of the facial nerve will come around the tragus 1 centimeter deep, and then it will move behind the mandibular or below the mandibular angle in the majority of cases, and travel until almost the distal third of the mandibular border, and then kind of go and heading in the direction of the depressor anguli ori and the depressor labii inferioris. So the marionette line itself is the center of this dangerous zone. So if you take 1 centimeter in front and 1 centimeter below, so you will have this as no-fly zone. So this is the dangerous zone where the marginal mandibular branch will be superficial and it can be in the zone of treatment. So if we can do the same thing from here, that will then easily define our most anterior border, and then you could see that the jaw can be easily drawn. This is here the mandibular border, this is the mandibular angle, and we can have this as the first zone. The fiber is quite long, it can reach up to 10-15 centimeters easily, but you don't want to fracture it. So when we use the fiber in the lower lid area, we use a 200 micron fiber because the skin is thin and the resistance is insignificant. However, when we move to more thicker area of the skin, we have to use a more robust fiber, so we use usually the 300 micron. So in a contralateral aspect, we will draw a similar area, and then here I will ask the patient to bend her neck all the way, and then you will see on the lateral view, may I ask you to do that while you are looking at that? Bend your neck, yeah? You could see this kind of like nice curve, and this here will define me the inferior border of the treatment. Can we treat the skin on the lower neck? The answer is yes. However, not in the central area. We need to avoid the light damage of the thyroid gland, and for that, the central area from the hyoid bone all the way to the jugular notch will be again another no-fly zone. In today's demonstration, we'll be focusing only on the upper neck, and for that, we will follow the laxity all the way under the mandibular angle and the mandible boser. So leaving around an inch of a cuff of no treatment to protect the course of the marginal mandibular branch. So we have treatment zone 1, which is like a small rectangular. We have treatment zone 2, which is a very large and quite thick, combined skin laxity and adiposity, and it's like a diamond shape. And we have the other contralateral jaw. So in this demonstration, we will be using a very high energy setting for the upper neck. That's because we need lipolysis effect, where the energy setting of the jaw will be gentler in a moderate range, because we just need a tightening effect and a mild lipolysis effect. And this amazing technology allows us to customize the energy in a very versatile way to suit the anatomical location and the pathology. So now I'm going to get on with the procedure. My focus will be on the patient. I will be happy to take some questions from Priya and then show you in real time how this procedure is done. The patient has already underwent a 3D and 2D photography and a full informed consent for both the procedure as well as the demonstration, and she's a great contributor to the society and almost always on stage, so she is very relaxed about this, and I'm very grateful for her to accept to be part of our workshop today. So I'm going to constitute the local anesthesia. And initially in the preparation phase, I can be really like any botulinum toxin injection, using very basic antiseptic techniques. I'm going to use relatively high volume, and that high volume is no more than 15 cc of tumescent solution. So I am very familiar of putting in the face up to 450 cc for certain procedures. So this is really very impressive. I didn't believe first when I started my first case, when I was told, yeah, 15 cc is more than enough. I thought, are you really sure? This was like one of the amazing realization about how technology is evolving. I usually will plan my infiltration to actually match my entry point for the procedure itself. So with the infiltration, I would have had a reflective process to see any tissue resistance. I will study the tissue with the infiltration cannula, and that will enable me to have a mental preparation for the procedure itself. Now I'm going to go into a semi-sterile phase. I will prep the patient. Can we put her in a supine position? Usually I prepare the patient and then I go into the sterile phase. However, in this case, we need to be time efficient, and I have the brilliant Priya with me, so I have the luxury of going into the sterile stage. So it's helpful if you have an assistant or a nurse or a colleague who is familiar with the procedure to help in the preparation. I'm using hypochlorous acid from Cleanset. I love the gentle nature of it, and also colorless, so it doesn't obliterate the landmark. It's a very powerful antibacterial and antifungal, antiviral, and also sporicidal. I don't have shares in either U-photon or in Cleanset. So I'll show you a very simple technique to have a sterile feed. Been reported by Mr. Awad in Wales, a fellow plastic surgeon, called the nun drape. You just get a sterile drape and you make a hole in it, and then you put it here, and then you can customize it to have the exposure that you need. Going to customize it here.
So Professor Ghanem, how long does the procedure usually take?
I have done my first roughly dozen, and the average is half an hour. It can range from around 20 minutes to less than an hour. I think in this patient's case, because of the degree of adiposity, we will go for a advanced setting. We might take some half an hour to 35 minutes just for the neck, but the jowls are going to be very quick. So I anticipate around 40 minutes.
So here today I'll just show you we're actually going to be using a 300 micron linear fibre. Now with these Endolift fibres there are two types of fibre. There's the radial fibre and the linear fibre. The linear fibre, the main difference between them is essentially the direction of flow of the laser. So in terms of the microchannels that you're creating under the skin, they can just be in either unidirectional, so with the linear probe, or they can be radial, which is a more multi-directional laser beam. And it's more than appropriate to have a linear fibre for the face areas that we're treating today. And it's a disposable fibre, so it's a single use. So today we're using this on one patient and throwing it away afterwards.
If you look at YouTube, some of the clinicians who have used this procedure, kind of like even working around the eye without eye protection, don't be alarmed. This, the device is super safe, but we have to understand the importance of using all precautions for laser surgery. And for that case, I am going to protect her eyes. And Priya, can I ask you something? So I was intending to do this, before I have a syringe. If you can just draw another solution, you can do that. Yeah, maybe 12 and 3. Making 15 and 4, because her neck is quite. So this is just a 25 gauge cannula that I'm going to use for my tumescent solution. And as you can see, I have my eye protection. The crew here also are protected and observing social distances. Okay, I'm just going to introduce the cannula now, so it's going to be slightly good. Well done. Thank you.
So how much will you put in each area?
I will put just 2 to 3 mils in the jowls. See her untreated subcutaneous tissue is quite favorable. There's no fibrosis. This is just a little bit unpleasant with the local anesthesia.
And has our patient had any treatments to that area?
No. We have only some toxins and fillers before. That will be more than enough. With the neck, I like to cross-hatch my treatment, and I will cross-hatch my infiltration too. In a way, I can reach up to the midline with this, but I'm just going to go back from the submental axis.
So how many?
Just 3 passes is more than enough.
And how many entry points do you think you'll be making for the whole treatment area?
5. Okay. Here in the central neck. Well done.
Is it possible to go from, say, the mandibular border into the neck if we were treating the neck?
Yes, posteriorly, although I recommend against it because, as I say, the course of the fourth branch will transect that territory. It will go from under the mandible to above the mandible, and then, with kind of like going between treatment zones might endanger the nerve. So absolutely no problem to have as many entry points as you need. As I say, this is a 300 micron, it's a less than an orange needle, so it will not cause. Can you look to that right? Yes, thank you. It will not cause any issue as far as scarring, and then there is no need to compromise the procedure by letting yourself. And then finally, the gel.
And how long do the treatment results last?
So that's a very important question. Many patients have this in mind, and I tell them, here we are not working with like marble, we are working with biology, and as a result, the treatment is going to reset the aging process. So if we were able to bring the patient's facial aesthetics to how they looked 5 years ago, then we reset the clock and they will start aging from that point. And as a result, we are resetting the clock rather than giving them results that is going to kind of like last. Biology is very dynamic thing, and it's very difficult to predict. But this is a thing of any laxity treatment that actually works. So results between 3 to 5 years can be achieved, and repeating the procedure can be done. In some cases, some colleagues over the continent has done the procedure monthly without any side effects. 3 monthly or 6 monthly is also safer. So in a way, I'm just waiting a little bit. As you know, the local anesthesia will take effect better if you give it a chance. And I'm going to go and move from the neck to the jowls. Now, according to the manual, if you see the manual of Photon Endolift, you will see that the variables are 3. First is the energy setting. The second one is the amount of time the laser energy is applied to the tissue. And the third one is the total amount of energy you delivered in one area. These at the moment are very customizable, and you have to stick to the protocol that is presented in the manual. However, this protocol offers a wide range, because as you can see, somebody with quite a thick submental fat is not going to behave similar to somebody who has skin-only laxity. So somebody who has skin-only laxity will be towards the lower end of the total energy delivered, the lower end of the energy setting, and then somebody with such adiposity and laxity will be towards the higher end of energy delivery and the higher end of the setting. So from that end, you will be able to go through the training when you engage with this technology, and then you will develop that also as you go along. The learning curve is really depending on your knowledge of the anatomy, your knowledge of aesthetic medicine, and you can transfer this skill quickly if you already have the existing knowledge, or you can take it along your learning curve. Okay, I think that's enough time for the local anesthesia. I'm going to start the procedure now. So
just to say as well, Professor Ghanem, we can use cooling devices, is that right? What are the main benefits of using a cooling device?
So, in a way, some body of opinion, we don't have hard peer-reviewed evidence for that, suggests that addition of water, because the chromophore here is water. So addition of water will then compromise the energy delivered, because this water from the local anesthesia is going to be kind of like competing with the water that is in the adipose tissue or in the skin. It is a valid point. However, we have to take also in consideration patient's comfort. So cooling alone can be used if we are using low energy setting, and if we are using very small touches, and that is absolutely fine. I think through my consultation with my fellow key opinion leaders around the world who have more experience than me, when we are moving towards a higher setting and higher energy delivery, it will be slightly uncomfortable for the patient to have cooling only. So that's why in this case we are using local anesthesia. And the amount that we are adding is really very small, that we don't believe that is compromising the energy delivery to the local tissue. Okay, so I am ready. You will see now there is a little bit of a dance that you will have to do with your assistant.
Will you be starting with the chin? Is that mental?
Yes.
Okay.
Yes.
So this has been cleaned. It's just set.
So both
So this goes.
Priya and I has sterile like gloves, and this segment of the cable has been wiped with antiseptic. However, it will not come in contact with the patient. Then you have here the fiber, which is fragile but strong in one. So you just have to treat it with care. And you make sure that they don't break it. There is a little cap here that you will get rid of. This is an easy screw on and screw off. So you can see here, you need to check two quality assurance issues. The first one is the integrity of the laser beam in the main cable, and then the integrity of the laser beam after it passes through the fiber. I found it difficult to breathe with the mask, but you know, this is the new world. So as you can see here, it's a perfect circle, so that means that this fiber optic is not cracked and it's ready to go. So I will be...
And do we also stress test the fiber as well?
So you can actually, it's a very easy procedure. You can see that it's bending like Beckham without any kind of angles or sharp kind of braids. And then now I'm ready. I will usually use a 5 centimeter to enter so that the fiber is stiff. You know, like when the light comes here, you don't see your entry point. And you can, if you are skilled enough, to kind of go through the entry point of the local anesthesia, but I found that very difficult because the light will blind you. But it's very easy to apply a little of energy when you are in the right space. You have to stay in the subcutaneous tissue. Okay, so for this lady, we are setting high energy now.
We are, so we're going for 3 volts with a T on 50, T on 50.
Awesome.
And so now the machine is ready for you to start whenever you want to.
Okay, so we're starting here.
So you're taking a lateral on the bridge.
Push, and we are in.
Okay.
So it's very important that you stay above the platysma, and for that you will see the laser beam guiding you. If I go under the platysma will hide the light, and I will know that I am in the wrong place. You can hear the popcorn effect of the post tissue popping. And then I'll just create my few passes. I usually apply energy in withdrawal, because more control. But as you advance, sometimes you encounter resistance, and then you can apply a little bit of energy and the resistance will go away.
So we can see that you've got a very uniform laser beam light coming through, which tells us that we're maintaining sort of the correct plane throughout those passes that you're doing.
Absolutely.
Maybe you can show us, Professor Ghanem, how it would look if we went too superficial, just so that our viewers know.
Very, very superficial, which is absolutely fine, but it might mean that you are going to go out of the skin now, which can happen, and it's absolutely fine. It's like another entry point. You would see very, very, very sharp light. Now, too deep, I'll demonstrate that the laser beam is gone. So you need to have this like gentle hue, which is not very bright and it's not dim. And it's really easy to discern. You are expected to manipulate the tissue a little bit. I'm expecting to deliver around, 1,000, 1 kilojoule in this area.
So in just the under chin area or both?
Yes, in the under chin area. So I'm going to kind of like in this tiny little triangles, I will have around 150, and then for the central area we will go for 700.
And so Ghanem, how do you decide when to stop? I mean, you've got some preset sort of numbers in your mind that you want to deliver about 1,000 joules after assessing the patient, but are there any other points where you think, actually, I might stop a bit short of that, or I could potentially go on for another couple of 100 joules?
Certainly, this is like the most important aspect of the learning care. And for this, you will see in front of your eyes that the tissue is slightly changing. It's contracting, and it's giving some erythema. So you can see here that 150, I feel that the skin is just slightly more warmer than my fingers. So we are arriving at maybe 38. We have an infrared.
We use some cooling as well.
Yeah, we have an infrared kind of thermometer that we can check the temperature of the skin as well. But that actually is a good sign. And also, if you see that there is erythema or there is some contraction, that's also a good sign. So the tissue here is quite supple, where here I can feel that the tissue has started to contract. So that laxity here versus the tightness here will tell me that we have delivered adequate energy at this level. So it's mostly tactile feedback rather than visual or objective. So can you please look away? Thank you.
Yeah, just to add to that, I think it's really important to continue assessing the patient. So having a feel what's happening to the tissue. Because if you are delivering, if you're at a point where you're starting to approach too much energy into one area, you might expect to see that the tissue is getting really thickened, it's getting warmer, much more erythema than you would expect. And so that would be a definite sort of, in terms of the traffic light system, a red zone, so you need to stop. How is the patient finding it? How are you finding it? Can't feel anything. Okay. So the patient is suitably numb. I find it quite comfortable. Is it quite easy for us to be to kind of traverse the hypodermis?
It is super easy. It's like taking a knife through the room temperature butter block.
And if the patient did, say, for example, have, say, acne scarring, they had sort of thicker tissue to start off with, what sort of tips do you have to sort of navigate your way into the skin layers?
So that's what I say. Like here, for example, I know that I have at least 2 centimeters of fat. So I am, as you could see, applying energy on like forward and backward because I am really comfortable that I only have fat tissue. So above me is fat and below me is fat, and that's my target zone. I want all this area to homogeneously receive as much energy and lipolysis as possible. But when you have like tethering and acne scarring and fibrosis, you are not able to move that freely. So you have to be more purposeful. You have to plan your passes very carefully, and sometimes you have to use the energy on advancement and then just apply it on back with roll. But those patients with fibrosis usually have better results because the fibrosis, like and the collagen content of water is very high compared to other tissues. So it really contracts very well and leads to good tightening.
Yes, we're just waiting, sorry, we're just waiting for the minutes for it to start.
So how many joules so far?
So now we are at 350 joules.
So that's
like 200 extra in that area. Do you think would you suggest it's a good idea to compartmentalise before you start so that you're clear on the amount of energy that is being delivered in the area?
I think so. Any complex procedure can be made super easy by breaking it to small, manageable steps. That's something that I taught my students when I taught microsurgery, and I taught myself. I used to find microsurgery very difficult and complex until my teachers taught me how to break down the procedure into very small steps that you overcome each at a time, and then the result will be successful total procedure.
So we talked a lot about how truly remarkable this is, but as with any procedure, there are possible side effects, possible complications. Do you mind just running us through, what are the common complications of this procedure, but possibly also some of the rarer ones?
So common slight tenderness for around a week, very, very mild swelling. You can see here that there is a little bit of swelling compared to this side. I'm starting to feel tissue tightening, which is actually great. How many joules so
We are
far?
now at 460.
So we have reached the 300 here. So I have actually delivered the 300 in this area. As you can see that there is a little bit of immediate swelling, and the tissue here is much, much tighter than the tissue here. So I'm very, very happy that this is going to contract very well, and I'm very happy about our setting. So here is really, really supple. Here is like a little rubbery, but not too rubbery. You can see that the skin is blanching, and the skin temperature is absolutely fine. So mild erythema, mild tenderness is absolutely fine. Sometimes when you are very, very superficial, there is like a little bit of a dermal little thickening, like a little spot that can happen and will disappear within a couple of days. The worst outcome will be just a lesion of the fourth branch, but as I told you, that is also manageable easily. So I can see immediately now that I have no definition whatsoever. I don't know whether you can see with me. I wish I had a mobile we will try to take photos and share with you for the recording of this, but if I am looking with you now, I have here no definition of the jawline. The cheek and the neck are totally in unity, but here I have a very defined step. The jawline has been defined by the tightening of the jaw and also the tightening of the submandibular part, and that is an amazing immediate feedback which will reassure me that this patient will have good results.
That was about 10 minutes of treatment time, wasn't it?
Exactly. So here we're getting to the other compartment. As you can see here, I am able, luckily, to go directly into the domain without creating another entry point. This would be fine to create another one. I'm stopping at the kind of thyroid crease. And here I'm going to be symmetrical and apply similar energy at similar arrangements going from superficial, immediate superficial subdermal to slightly more deeper subdermal, but staying always above the muscle.
And how many treatments does a patient require?
I think for her, I anticipate that we'll have really good results. She doesn't need a totally sculpted jawline, and I think one treatment might be enough, but we might be able to repeat this treatment in 6 months to 9 months if she wanted more definition, at no problem at all.
So we've seen that you can achieve some fantastic results straight away.
Mm-hmm.
What will happen to this result? Will it over time, and when do we get to see the final result?
Of course, now after the inflammatory response of fibrolysis, there will be mild swelling. So that will now cloud the picture over the next few days, up to a week. And then when the erythema has been settled, when the swelling settled, then we will have an early indication of definition maybe in second week. But then maybe 50% of the results at the end of the first month, 50% month, 3, and then kind of like final results between 6 and 9 months.
Okay, brilliant. And is there any, downside to having multiple laser treatments?
No. I mean, you have to examine your patient, make sure that her tissue has relaxed, has come back to the start point. As I told you, with patients with severe laxity, colleagues have been treating them with, kind of monthly treatments with absolutely no issue. How many joules so far?
We're now at 690 now.
690. So we started at 415.
Yep, 460.
So we'll stop around. So that's 300 almost?
Yep.
Okay, perfect.
That
So
gives you the final two.
again here I can see that this tissue has moved from being supple to being firmer, and then the whole thing is really firmer. I'm very, very happy with this result. And I can see that the last loose tissue is that little triangle that I've treated first there. And then also I can see slightly asymmetry, a little bit of bulge here between the border of the treatment zone and no treatment, but I'm going to feather that in my entry to the last treatment zone of the submental area. Thank you very much.
Do you find, Professor Ghanem, that when you're approaching the end of a treated section, that there is a change in the way the fibre moves, or is it just the same, just as easy to pass the fibre through?
Yes, I mean, towards the end of the procedure, the fibre will be, seeing some resistance, and then that's because, the tissue has condensed, and that's absolutely normal. Sometimes you might go through a superficial vein and create a bruise. So that's, you ignore that and you continue delivering the energy. Because, the blood is not really a chromophore here, it's just the water. So you just ignore that if that happens.
So you can just continue passing your fibre over the...
Exactly.
Even if you've got a very small hematoma?
Yes, I mean, in a way you just try to apply pressure and then negotiate the tissue there. I'm not sure because my glasses blocks the green.
Yeah.
So, but I see some superficial vein in her case.
That's right.
And then, I might inadvertently go through that.
So you can still hear all this crackling noise.
Yes.
So we're getting an adequate amount of lipolysis happening here in the submental area.
How much are we now?
We are 869.
Okay, so just another
130.
You do 150, 150, 600, is that right?
That's right.
So we will reach 900.
So we're at 900 now.
Okay, perfect. So I will just reassess. Put your head as up as possible, yeah? So you can see now I have really nice firm tissue all over. These are the little dermal condensation that I told you about, and they will disappear within a couple of days, and there is maybe another one here, so it means that the fiber came very close to the tissue. You could see some erythema here. The tissue is slightly warmer in this triangle compared to the others that has been cooled down now. And I'm looking, and that kind of like union between the cheek and the neck that was there is gone, and I have a nice step here. And maybe I can ask for maybe a screenshot, maybe it's difficult. We will show it to you when we set the patient up. But I'm really happy with the definition that
you
has
can already
achieved.
see that the jawline is really sculpted
And
now.
I really don't want to go farther because I have lost all the laxity of the tissue. I'm happy that I was homogeneous and I've delivered enough energy here. So that's the most difficult part of the procedure. The jewels are going to be really easy, and they will also further define and refine this procedure. And then I'm going to go now and deliver around 150 to 200. I'm going to drop the setting a little bit, so it will take a little bit longer, but it will be gentler on the face. So we will go from high energy level to intermediate energy level, and from long time exposure to intermediate time exposure.
So I'm just tweaking the settings slightly.
Okay, thank you. Before 40, yeah, well done. Okay.
So we're just waiting for the machine to read those settings. And then ready, we'll just start, just so that it's clear for you.
Awesome. So as you can see, now you will see, for example, a number which might be 150 or 200 joules, but these do not translate joule per joule for the energy delivered here, because the exposure time is different, the energy level is different. This is like a customized, tailored energy delivery to the tissue, because we have almost only 1 centimeter here, where we have like much more kind of like thickness there. Okay, so we are in the right trim plane, and I have here the danger zone marking is not obliterated, so I put a finger on here, right line, to remind myself of this. A little bit of tension will help pressing the fiber in this area.
What would happen if you were to say deliver the laser energy just on the dermis before you pushed in? If it was a prolonged,
a little tiny burn that will regenerate without scar, but it might be like a tiny little needle scar, so that could happen.
And some patients have reported just a very transient paresthesia, which actually finding is quite normal after a few days that settles down.
Of course, we are delivering the energy to the water content in the nerve sheath, and the superficial nerves will be cooked. So the paresthesia is very, very normal, and will last. As you know, the nerves generate by around 1 millimeter every 2-3 days. So we are not damaging them for long distance, so they will regenerate within a week or 2. In some like deep energy-based devices that I have used, I saw paresthesia lasting for up to 3 months. The patient tolerates well. Sometimes with breast procedures, paresthesia lasts, for kind of like a year. So after liposuction, etc. So this is a quite common manifestation after energy-based delivery.
And at times when you're getting to higher energy levels of delivery, you could even sit the patient up with you and potentially test them after when you're doing that.
Absolutely, we will do that here. Absolutely, we will do that here. I think with the local anesthesia, you might or you might not find that it's affected. So the best time to test it is around 2 hours after the procedure. But even if if the patient has a flicker of it, it's reassuring. And as I say, it's a really, really rare. We are talking about 2 in 5,000.
So aside from the face treatments, at 120 now, aside from face treatments, it can be used in other parts of the body.
Yes, absolutely. It's a laser lipolysis. So everywhere there is a fat, you can use this procedure to debulk it. Everywhere you have lax skin, you can use this procedure for the water and the collagen to tighten it. So actually, the sky is your limit, and the knowledge of anatomy and your competence around different parts of the body is your limit. It's like a scalpel. You know, where can you use a scalpel? Yeah, from the toenail to the scalp. So exactly like that. This is just a tool. Yeah, I'll just deliver 200. I think that will give her nice results. We are almost there. Are you okay? Are you comfortable?
Yeah.
Awesome.
You're still not feeling anything in the down onto your jaw?
A little bit, but not, it's manageable.
Amazing.
Okay, sad face. You could see perfect marginal liver nerve, even after almost 1,100 joule delivery of the area. Okay, great. Final treatment area. You could see with the straining, I don't know if you can see on the camera, with the straining that has been happening with my fingers, you will see some light escaping from microscopic cracks in the fiber. So that's why it's very important to use the fiber only once, one fiber per patient. So although, in theory, like this is a durable fiber, but the quality of the procedure will degrade if you have a very, very large area in the abdomen, etc. You might consider using 2 fibers to optimize the treatment result. And cost effective is in your favor as a clinician. And it is in the patient's favor for quality.
It's quite possible to test the fibre, isn't it? Just to check the light beam that's being emitted halfway through the procedure, or when you get to sort of 1,000 joules, to check that the light is actually, a perfect circle and a complete examination there.
Absolutely.
It's important to say on the device that the black fibre that you can see around Professor Ghanem's neck is again, it's a very delicate fibre in that. And that's actually good to replace after you've done about 100 treatments. Because again, you've got to be checking the integrity of that fibre, and what we found after years of experience is that it's adequate to change after about 100 treatments, just so that you're not compromising the analysis as well.
This is really, really nice procedure. I love it.
Is it quite difficult to do, or do you feel sort of...
You have to develop dexterity,
Yes.
It's a very tiny fiber, and you kind of like, you sometimes get frustration if you encounter a little, you want to physically go there. No, it's better to just apply a little bit of energy and then pass easily through the resistance rather than fight with the fiber. It's really, really nice treatment. For me and for my patient. I mean, like for me, when I use some energy-based devices and see the damage they cause for my patients, I really feel guilty and always pray, for them to heal very well. But with this, I have comfortable nights.
Great. And what sort of alternative treatments do you mean? So, what could this be used instead of?
So in a way, like as I said, in the 80s, any patient with mild laxity had a facelift. So always surgery is an option if the patients, kind of like had very, very significant laxity. I don't think they should be offered this because the improvement is going to be, kind of like tailored to the patient expectations. So patients with extreme pathology and high expectation, should be probably converted to surgery. And like another, kind of like alternative would be threads, but threads, will not last long, and there are kind of like redistribution rather than treating the actual problem. And then another thing would be radio frequency energy or high focused ultrasound energy. All these sighting devices have their advantages and disadvantages. For me, as a surgeon and as a practitioner, I find this an amazingly promising procedure. How much joules?
So now we're at 300, so we've done 130 things there.
We are 330?
310.
Okay, so 110. So we get around 90. We did 200.
We did about 176. So obviously the laser 1500 device, Professor Ghanem, can be used for Endolift, but there's another potential procedure coming out of this, isn't there? So you could do the light scan and combine that with your patient. When would you use the fractional light scan?
Every patient. So this is a non-ablative laser resurfacing. You can use it, for improving the sun damage, fine lines. 4 or 6 treatments are really easy to facilitate, and it will enhance the results greatly. How much are we on now?
Now 340.
So we are there? Okay, awesome. So I can feel also the tissue tightening of the sad face, and we have like an integral marginal mandibular nerve. So you can see now the erythema evolving here and disappearing here. So it's a very transient sign that tells us that the tissue has thanked you for delivering the energy. A little bit of the dermal kind of condensation that will settle later. Now, this was quite a lot of lipolysis, relatively speaking. So we are going to use a little pressure gun that the patient will put to remodel and push the edema and then enhance the results and collagenesis. I will tell them to put it for 3 to 5 days, depending on the degree of original laxity, and then put it nightly for as long as they can afford over a period of 3 to 6 weeks. I'm sure over this period we'll be closely monitoring our patients and tailor our post-operative care with them. So that was all really, and I would like now to sit the patient up, maybe ask her a little bit feedback on the procedure, and then maybe give her a mirror to see subjectively if she can recognize, because the patient is the best expert on their face. So we'll ask her whether she can recognize, any changes. I'll just sit her up and then get a mirror.
And this is the gun that you can use. There's many different types that you can use, but I'll show you just when you're sitting up how you need to wear it at home. So try to use it for at least 5 days. Essentially, this is where your chin goes, so just under here. And then obviously you've got a headband on, but it goes quite tight, and your ears can clip in there. Quite tight, and what we're trying to do is just enhance that sort of contractility that we've induced in the tissue, and it just holds everything in place. You can obviously pop your ears in there in the back there to make it more comfortable, but it's just supposed to be a harness to really kind of hold on to that contractility that we've seen as an immediate effect. I'll remove that now for you, just so that we're able to better appreciate the results. How did you find that?
It started off I didn't feel anything, but towards the end I could feel it, but it was manageable.
Okay, so you wouldn't
I
say...
think I've got quite a high threshold, pain threshold.
Great.
So.
Just to reiterate, we use a very small amount of local anaesthetic in, and not once did you look as though you were in pain.
No.
Or, we always say to the patient that please, let us know, communicate with us if it was getting too painful, and obviously put a little bit more local anaesthetic in, and just wait 5 minutes for that to kick in. So, you said you were an absolute star patient and you tolerated it really well. Can you feel anything different?
Yeah.
Can you feel the tissues contracted?
It feels like it's really tight under here. Yeah.
And is that a sort of an uncomfortable feeling, or does it feel quite good in a way?
Maybe a little bit uncomfortable. I think maybe it's just because there's a feeling there rather than not a feeling.
Just
there.
a different feeling.
Yeah.
Great.
It's like a toothache kind of feeling.
Which is temporary, and that won't last long.
Yeah.
But in terms of any numbness or tingling of your face, your jaw, or the chin area, can't feel anything like that.
No.
Fantastic.
Yeah.
Great.
Okay, so have a look, and a little bit of swelling, but do you see any changes there?
Yeah, it feels more defined here.
Yeah?
Yeah.
Very good.
It's hard to tell because it's
very swollen and tight, and that's why we need to get that pressure garment so that we can model the tissue very well.
Yeah.
But I'm confident you will have a very nice results. We have Great treatment, and you're an amazing patient. Thank you.
Thank you so much for being here today.
Okay, so shall we put the pressure gun?
We just put it on. I just showed our audience and also the patient how to apply it. But yeah, so we can put that on immediately as soon as you leave, or as soon as you get home. And just like I say, put it on for at least 4 to 5 days.
How many hours?
So you can remove it whenever you want. If you want to kind of go for a meal out or you want to have a shower, etc. We say around 23 hours, to give you that hour. But 20 hours or 21 hours is fine. Most of my patients don't use it really. But for you, especially for this area under the chin, because we have remodeled the fat and the body will then have an inflammation to clear the dead fat. So that inflammation will create edema, which means water in the tissue. So the pressure garment will help push that away so that water in the tissue does not become like cement, which is the collagen. So we want the collagen not to create thickness there. We want it to push it away and create like a sling to lift your face rather than clutter there in the middle and create a little thick kind of area here. So from that end, it's helpful to kind of like put it in the first week. And then after that, nightly, when you go to bed, for as long as you can tolerate it, 3-6 weeks is absolutely fine. So it's like when we break our hand, we put it in a splint so that the bone heals in a favorable position. So in a similar way now, we have altered the integrity of your tissue and we want it to heal in a favorable position, and that little sling helps us that. There's no evidence for that, it's a common sense.
Right,
Okay?
Yes.
Great to have looked after you today, and I'm very grateful on behalf of all the audience. Thank you so much for being with us today.
Should we pop this back on?
Okay.
But also to say that we should, we'll also take some serial photographs, thank you, so that we can see objective difference. And it would be nice for you to also see, you're comparing your before photographs to your after photographs. And usually the time intervals would be around we'd say 24 hours post. So immediately post, 24 hours post, and then 1 week later, 1 month, 3 months, and then finally at 6 months. When possible, coming in to see us, or if advised coming in around 1 month, 3 months, and 6 months, just so we can see you in person and hear about your experience.
Alright.
So I'll ask you to wait for me in the waiting room, just to check you out before you go. I will conclude this workshop with the audience, and then I'll come and say goodbye, okay?
Okay. Alright, lovely.
Thank you.
We'll just drop the flag a little bit.
It's quite a way down.
What should I do with the headband?
So you can just leave it here. Thank you very much. I'll see you soon. Bye.
Okay, so that concludes our live demonstration. I really hope you've enjoyed it, and we really enjoyed talking about it and delivering I'm sure Professor Ghanem has really enjoyed delivering the presentation to you. If you wanted to get in touch, find out a little bit more about the procedure, about purchasing a device, then you can contact us at info@endoliftlaser.co.uk, and we'll be happy to answer any of your queries. Of course, if you do go ahead with wanting to introduce this fantastic procedure and this treatment into your own clinic setup, then there will be training involved, and this will be rigorous training. It's important to mention that a basic core of knowledge in laser is very important before being able to deliver this treatment to patients. So that's one of the major prerequisites of using a laser device in this country. But yeah, we'd be more than happy to go into a lot more detail about the device settings, about patient selection, when we come and deliver your training as part of the medical team. So thank you so much. Anything you want to say, Professor?
No, it's been pleasure to see you all virtually. Please come and say hello. I am in Central London, and drop us emails, engage with us, follow us on Instagram. And we look forward to have many of you as co-colleagues and teammates in the Euphotron Endolift Team UK. Thank you very much.
Thank you.